you guys doing? I hope you guys are all doing well. This video is gonna be on what you should have in your nursing bag. Like if you're just starting out, like maybe there's some things that you haven't thought of or whatever. And then basically, it's broken up into categories. You have your like personal things. You have like, you're gonna need like a pencil case, not a case, like a bag. And then you're gonna have like your nursing things and different types of like materials, like written materials, okay? So the first thing I always keep in my bag is a work jacket. Like I don't like to wear anything from work in the house. Like I'm gonna go wash my hands as soon as I'm done this video, because anything associated with work to me is like healthcare germs. It could be, I don't know, just could be contaminated. Like I just keep my work stuff and home separate, okay? So I have a work jacket. So the other category I didn't mention would be food. Like I always have a bag of food, and it's like popcorn. Just have something to eat and drink. I always have a bottle of water. And especially with the masks, like you have to take time for yourself to eat and drink, because sometimes you get home, you realize I didn't drink anything. So always have a bottle of water. Have a pencil case. I keep saying case, I mean bag. Of course pens, but always have your scissors, because you need scissors like all the time in nursing. Like just have them in your pocket. And then it's always nice to have like color, like on your report sheet. Like I just enjoy it. It makes it, you know, a little more interesting. So always have your scissors, and also scissors, pens, highlighters, and Sharpies. I have different color Sharpies. Like you use Sharpies also in nursing, like all day long. Like you're labeling, putting dates on everything. So, and you're labeling patients' belongings all the time. So always have Sharpies, always have pens, and highlighters. So you can highlight what you already did and keep track of what's done and what's not done. And if you're a color coder, that's awesome. Another thing, that I keep in my bag is like these little cards they give us. Like over the years, they give us like little cheat sheets, Omnicare, MedPass checklist, like things like that. So just have a something to put stuff like that in. This little, you could put your CPR card in there, your license. What else? Where is it? You also need somewhere. I cannot find it, y'all. Also, and always have lotion, definitely. As much as we wash and sanitize our hands, always have gel, because taking the face masks and the face shields on and off makes it extra necessary. Like, oh my God, I'd be walking around looking crazy. I get to a mirror and I'm like, oh my goodness. So always have your gel. Also, I cannot seem to find it. Where the heck is it? Also, of course, keep a drug book for when you're documenting. Also, oh my God, I'm dropping stuff all over. Perfume, definitely. And personal things like nail file, band-aid, hair tie, toothbrush, makeup, like deodorant, Definitely have your personal things, because if you're going somewhere for 8 to 12 hours, you're gonna need some stuff. Also have just a baggie like I have or whatever with masks, so you're ready to go in for your shift, because you don't want to not have a mask in the car and then walk in to work. Like, that's just irresponsible. And then have a little here it is, a money thing. So if somebody's going out to Wawa or whatever, you have your money already in one spot. And always keep like 10 bucks in there, nothing too much. And also, like, anything that you, let me just put this right here, anything from school, like if you're in school or you still have handouts from school, keep those handouts. Like this one, for example, has different positions to drain the lungs. Like, you're gonna forget all that. So you can drain the posterior lungs, left and right, anterior lungs, left and right, you know. So also Tavers, I think these are probably approved, what are they called, abbreviations. So don't go too crazy with these. Like, it has to be a pretty common abbreviation for you to use it, because otherwise your DON is just gonna be like, what the heck are you talking about? So and then I have, like, for an assessment, I kept this from clinical, so that if I'm doing a generalized note, then I have just checklists for each system of the body, like psychosocial, neuro, GIGU, like, you know. Can't find that paper, but is it this one? Yeah, so it has each system, and then it has like things to cover for like GI, GU, musculoskeletal, and it's just like prompts, like, so you can have like the best documentation and you could say whatever you could say. Like, you might not think of full range of motion, steady gait and balance, but you can address those things. But you know, documentation is a whole other video. I'm not gonna get into that. But have your things for reference that, you know, you're not necessarily gonna remember all that kind of stuff. And that's basically what you need. Of course, when it comes to nursing tools, you're gonna need your stethoscope, of course. Your job should have a blood pressure cuff, and then have a tape measure. If you have a patient with edema it might be new onset, or it might be worsening if their CHF is getting worse or whatever, or they're sitting up longer. If they're being treated, you're wrapping their legs every day, you need a tape measure to see if their swelling is going down or it's getting worse. So how are you gonna know? Like, you can't just sit there and say, oh, the swelling is getting better, and you have no measurements. Like, that's not factual. That's like your opinion. So again, documentation is not topic of this video, so I won't get into it, but that's basically what you will need in your nursing bag. Make sure you have a nice big one, because like I said, you're going somewhere for 8 hours or 12 hours, and it's basically like, you need a lot of stuff for that amount of time. So take that into consideration if you're a new nurse, or if you're not a new nurse. Maybe I helped you to think of something that you didn't think of, so let me know if it helped you. Also, I forgot to mention a pen light. Definitely have a pen light for assessment. Like, you need it for if the room's not well lighted and you're looking at a wound, or you need it to look in the inside of the mouth or pupils. Definitely have a pen light. And that's basically it. So if this video helped you, hit like and subscribe. I would really appreciate it, okay? And if you want to see something else, let me know. And that's it. Talk to you guys soon. Bye.